Hi Clayton, how are you? Good?
I'm good.
It's good. So I'm just going to have a bit of chat to you. You've recently been on a trip to China, haven't you, with your wife?
Yep.
And when were you over there?
We're there for September, October.
Okay. And why did you go there?
See the family.
So your wife's Chinese?
Yep.
Okay.
And also my wife wanted to get some laser surgery on her eyes.
Okay. And where were you going to get that done?
She found some place in Beijing. Turned out to be the military hospital, which was quite impressive.
Okay, so it's a Chinese military hospital that conducted the...
Yeah.
Okay. And so she'd made all the arrangements prior to going there?
Yes.
And she had a price for her eyes?
Yeah.
Which was how much?
I think it was about $1,500 for the two eyes.
Australian?
Yeah.
1,500 Australian?
Yeah.
Okay.
So it's pretty much in the centre of Beijing.
How big a building?
Oh, huge, you know.
10 stories, 15?
At least, 10 or 15 stories.
15 stories, okay.
Yeah, takes up most of the block.
You got in the elevator and you went up to the 4th floor?
Yeah.
And tell me what happened when you came out of the elevator.
We were greeted by the nurse greeters.
Okay.
And the nurse greeters were there to talk to us, be nice to us, to help us make the decision to have our eyes done.
So at this stage it was both of you, was it?
No, at this stage it was Lillian was going to have hers done,
right.
But she said to me I should just have them look at my eyes for 500 UN or whatever it was, or 100, I can't remember.
So
it wasn't a lot of money for them to look,
to check out your eyes.
check out my eyes and see what they could do.
Alright, so I'll just go back a little bit. So you were greeted by the nurses and Lillian was booked in for an appointment?
Yes.
But you weren't booked in?
No.
Okay. So most of the conversation was in Chinese?
All of it was.
All of it was in Chinese. And so how long after you arrived there, were you wearing, oh, go back a little bit, were you wearing glasses when you came out of the elevator?
Yes.
Okay. How long after you arrived there and they spoke to Lillian, did they approach you to get your eyes looked at?
Straight away.
Almost immediately?
Yeah.
Okay. So, so how long after you arrived there with Lillian were you sitting in a chair and someone looking in your eyes?
10 minutes.
10 minutes. Okay. And through Lillian translating for you, I'd imagine, was that right? Your wife was translating for you?
Yes.
So what did they say to you?
Well, at the end of the testing, which was quite thorough.
How long did it go for?
A couple of hours.
Okay.
A couple of hours of testing, and you know they had all these imagery machines. They said, "Oh, we can do something with your sight. We can make it better." I thought that's great. Okay.
Did they give you an indication of how much better it might be?
Yes, they said that after 3 months my eyesight would be as good as it was now with glasses, but without having to wear the glasses.
Okay.
At least.
At least? Alright. And how much was that going to cost?
1,500.
Okay. And how would you pay for it?
Cash.
Cash. Did you have 3,000 on you at the time?
No.
So how did you get... I take it they wouldn't operate till they had the money?
No.
So how did you get the additional money?
ATM.
Where was the ATM in relation to...
Down in the foyer, on the ground floor.
Okay, so they had an ATM on the ground floor. Well, it's not unusual in a hospital to have an ATM on the ground floor. Alright, so, and when did they say they could do it?
Well, Lillian's was being done the next day, and we decided to wait a couple of days for hers to be
settled
better,
down.
and then we would do mine.
Alright, so you're going to wait a couple of days for hers to settle down, get a bit of vision back, and then you're going to do yours, so you weren't both recovering at the same time?
Yeah.
Okay. They had no trouble getting the appointment?
No, no.
Okay. So, so you've been there, you spent a couple of hours in the chair, they've had a look at you, they can get your eyesight as good as it was, as it is with glasses, but without wearing glasses, and probably better than that.
Yeah.
Okay. And no complications doing it?
Well,
they couldn't see any complications or any reason why it wouldn't be successful?
Nothing was ever mentioned.
And so that day of the appointment, that we had the examination, did you pay money that day?
No, I think we paid the day.
What happened? You got there, you got at the elevator, they met you again, they know you at this stage?
Yep. You've got to pay down in the foyer, and you bring up your chit saying that you've paid.
Right.
You go through a induction, because there's like a group of people there. It's a bit of a meatworks.
So how many people were getting your eyes done that day?
Well, in my group, there was about 8 or 10.
8 or 10, and how many groups do you think there were?
Oh, look, they probably had that many people per hour, every hour and a half, something like that.
Okay. How many were foreigners? What percentage?
Well, zip, other than me.
So most of them were Chinese? They're all Chinese apart from yourself?
They're all Chinese.
Okay. So in you go, they give you a full or local anaesthetic?
They just put some drops in your eyes. They put you in a gown.
Right.
Put some drops in your eyes. I think they give you sterilise your face.
Right. And then the operation is a laser operation, or?
Yeah.
Talk us through it.
Well, what they do is they do each eye at one at a time. They put in a device that holds your eye open so you can't blink. Then they put a template of some description over your eye, which allows them to put a knife onto your cornea, and they rotate that knife, and the template is circular, so they rotate that knife, which causes the cornea to be cut almost all the way around. They just leave a small flap, and then they lift up that flap, and then they do the burning, and the burning time and the position of the burning on the lens determines or is dictated by your whether you're long-sighted or short-sighted, and what had to be fixed. Most Chinese have short-sighted problems, so they're trying to reduce the curvature of the lens, so that they cut a small aperture, and it is a short burn time.
And what was were you short or long-sighted?
I was long-sighted, which meant they had to cut a big hole in my cornea to get to the peripheral of my lens, and then my burn time was one eye was 110 seconds, which was quite a lot of time involved.
Okay, and much discomfort while the burn was on, or did the drops cover it?
No, yeah, it was uncomfortable. It didn't hurt. I understood what was going on at each step, which was quite nasty, you know.
Okay. So they talked. Who was doing the translation?
Well, no one.
So at this stage, you're in a room with medical staff.
I had Lillian in with me.
Okay, so Lillian was translating.
She was assisting, to translate the basics. You know, lay down. You know, put your head this way. You know.
Okay. So how long did the operation take in total?
5 minutes.
5 minutes. What was the recovery process? Where did you go after you came out of the room?
I went outside and went home.
Immediately?
Yeah.
What aftercare instructions were given to you?
They tell you to make sure you have polarised sunglasses, which you've got to wear all the time that you're outside or in any bright light. They give you a couple of plastic lenses that you're supposed to tape over your eyes at night so you don't injure your eyes while you're asleep. And they give you a range of eye drops.
Alright. So your eyes didn't have pads, you weren't totally blind?
No, I could see.
Okay.
I could see.
Alright, and how was your vision at that time? Well, I suppose you had drops with it compared to prior to the operation?
Well, it seemed to be marginally better immediately after the operation.
Okay.
But I guess there wasn't a lot of swelling that occurred at that stage, so but then it went downhill
Oh.
fast after that, which is natural.
How long did they say the recovery would happen before you sight?
3 months. 3
Three.
months before I would have normal vision.
Normal vision. And what instructions as to wearing glasses were you given?
Not to wear glasses for 3 months. Try not to read, watch television, or use a computer. And I'm thinking, well, how the hell do you go back to work?
So not to read, use a computer,
Yeah.
or watch television for 3 months. Okay.
Yeah, things like that. Make sure you don't bungee jump or parachute or anything that would put a pressure on the eyeball.
Was that written or verbal?
No, that was just through Lillian.
That's through Lillian talking to them, so it was a verbal instructions to you?
Yeah, the whole thing was verbal.
Okay. All right, so you come back to Australia after the trip. How long after the operation were you back in Australia?
Basically a month.
About a month.
Yeah.
So over that month, did you wear glasses in China?
No, just sunglasses.
Just sunglasses.
Yeah.
And when you got back to Australia, how had your vision changed?
It seemed to be getting worse.
Worse. Were you in any discomfort?
I was in extreme discomfort from the first day. I had. We went back the next day because of the discomfort I was in, and they told me that I had an adverse reaction to the operation.
Okay. So you were back within 24 hours or back within 12 or 14 hours with an adverse reaction, with extreme discomfort, and they said you had an adverse reaction. On what grounds did you have an adverse reaction? What did they say caused it?
They didn't. I think what I did was had a reaction to an adverse operation. Okay. Because as I said, most Chinese are short-sighted, so they have a small aperture and they have a short burn time. I had a huge aperture and a long burn time, which meant that there was a lot of damage, trauma
to the eye.
So I think naturally it was just incredibly painful. It was swollen up.
So you were moving close to tears, were you? Or?
It was one of the worst nights I've had amongst
in your life, and you've had
nights, yeah.
And did they give you anything for it?
They gave me some anti-inflammatory drops, which
did they work?
Yeah, they did tend to work. They tended to help a bit, and they did tend to help the vision a bit because they reduced the inflammation, and so I was able to see a little bit better.
So as we're taking this today now, how long ago was the operation?
3 months ago.
3 months ago, basically till today. So right now you're
almost to the day.
Almost to the day. So right now you're supposed to have pretty much good vision.
Yeah.
Okay. So how is your vision today?
My vision today, my long vision is 4 times worse.
Right.
And my short vision is probably more than that.
So it's just...
It's stuffed.
Stuffed, okay, yeah. Terrible. So
I'm wearing my glasses at the moment that I had before, just so I can sort of roughly see stuff.
So you're just seeing shapes and blurs and...
Yeah.
Okay.
Yeah.
Terrible. All right, so you were still in discomfort when you got back to Australia?
Yeah.
So tell me about the discomfort and what you decided to do.
Well, I wasn't happy with the progress. I felt that it was going backwards. You know, I had been reading, although they said not to read, I had read, done some reading in China, and I had looked at a computer screen, and I had noticed while I was in China that there was a progressive change for the better initially, but this changed when I got back to Australia, and I felt that it wasn't getting better, so I went and saw my GP and said I need to go to a specialist.
How long ago was that?
That was about a month ago.
Okay.
So I had to wait a month to get in to see him.
How long ago was that?
That was about 2 weeks ago.
Okay, so on the day you go to see the specialist, what happened? You go and see the specialist, you explained you've been to China, you had an eye operation, and you're in discomfort and your vision's worse. So
Yeah.
what happens then?
Well, they ran me through a gambit of tests and stuff, and then told me that I was basically losing my sight because of something they call epithelial ingrowth. And it's basically the epithelial cells, which are the cells that cover the outside of the eyeball, had been dislodged and moved into underneath, growing on the inside of the eyeball
Instead of the outside.
instead of the outside.
And that was a result of the operation?
That was a result of the operation.
Direct result of the operation.
And they said, we need you to go to the Sydney Eye Hospital right now.
Okay.
Which scared the hell out of me.
So immediately just got you out of the chair and sent you to the eye hospital?
Yeah, he rang up the top man there at Sydney Eye Hospital and said, you need to see this guy today, it's important. And we got in the car and drove straight there.
Alright, so you're going to the eye specialist, he's got a bit of background on you about the operation in China, the eye doctor's spoken to him. You sit in the chair, he examines you, tell me what happens then.
Well, I had about 6 eye specialists come and have a look, because this epithelial ingrowth is not a common thing.
Right.
So they were all interested. One of them noticed in my left eye, which had continued to be sore from the first day and it never stopped. It always felt like there was some sand or something,
grit
in my eye constantly. It was always red and sore and runny.
Right.
And he said, there's something in your eye. And so he anaesthetised my eye, and he got a needle and he dug out a lump of plastic that he felt was from the cutting apparatus, because it was actually buried in the peripheral of the wound from when they cut the flap.
So a bit of the operating apparatus had broken off and embedded itself in your eye,
Yeah.
and had been in your eye for 3 months.
Yes.
And would remain to be in there had you not been there to this day, had you not sought further medical attention to it.
Yeah.
Alright, so they've examined you and they've removed this foreign object from your eye. What did they say to you then?
They said that if we leave this alone, he said, it's already grown halfway across your cornea, and if we leave it, it will grow completely across your cornea and you'll be blind. He said we could keep giving you glasses, and they'd have to be stronger and stronger and stronger, but eventually no glasses would help.
What period of time would you start to go
Well,
blind?
they didn't say, but they said it was in 3 months it had grown halfway across
So
the cornea, so 6 to 12 months.
you'd be blind.
They said what we have to do is recut the cornea and to peel it back, and we have to scrape all the epithelial cells off, and then we have to stitch the cornea back in place, not just sit it back in place, to try and stop the epithelial cells from regrowing.
Okay, and when's this going to happen?
That happens in 2 days' time. I'm going in tomorrow for scans of my eyeballs. They're going to map my eyeballs for the operation, and then the day after
You got the operation.
do that. Yeah, so they feel that they can save my eyesight. They can't guarantee that this epithelial ingrowth won't come back.
Right. And what degree of vision do they think you'll get?
I'll have glasses, and they'll be worse than what I've got.
So you're
currently got now, so I'm going to lose vision because of this, not gain anything. And if I have to have this operation again each time, I'll lose more vision.
a bit more each time.
Yeah.
Do you have any redress to the surgeons in China that did the operation? The initial one?
We've discussed it with a local Chinese solicitor and an overseas Chinese solicitor, and it's very, very, very hard, especially when it's a military hospital. It's not a lot of redress.
All right. Was there anything particularly special about your loss of vision, or your degradation of vision prior to the operation in China? I mean, you just normally just going blind from age and nothing?
Yeah, I really didn't have any great long sight issues. I just had normal myopic loss due to old age. Just a bit worried, you know, Chinese doctors, you know, think about these things.
But because of the professionalism of the suites and all the rest of it, you felt comforted?
Yeah, the people were really nice and they seemed very professional, you know, all this sort of stuff. But unfortunately, it hasn't worked out that way. The doctors feel that the knife apparatus has not been used properly
or correctly.
Yeah.
How much would the operation have cost in Australia to get done?
About twice that.
About twice that?
Yeah.
All right, what I'd like to do is come back and talk to you after the operation and see how it's all going. Are you happy to do that?
Sure.
All right, thanks Clayton.
No worries.